Cesarean section. Cesarean section is cutting across the stomach of a pregnant lady to deliver a baby. It is always used where normal delivery has failed. Only that it has become rampant nowadays, not like the days before, the days of our grandmothers and mothers. It has become so rampant, and in this video, I'm going to tell you points on how to avoid cesarean section. My name is Sarah Dong. I'm working with the Comfort Home Nursing Care Services. It's a medical company, a group of medical professionals, and we offer the following services. We do post-surgery and wound care, elderly nursing care services, stroke recovery, palliative care, early discharge from hospital, nursing consultations, physiotherapy, cancer care, and diabetic care. So let's go straight to the topic of today as how to avoid cesarean section. Cesarean section is helpful where normal delivery has failed, but it also has disadvantages and advantages. It is a major procedure that is done in theater, so it has also its negative outcome, like overbleeding, infections after operations, damaging of body organs during operations. So cesarean section cannot be better than a normal delivery. It is always better for a pregnant lady to plan for normal deliveries and let the cesarean section just come as a second option to your delivery options. Point number 1. Attend antenatals. Immediately you realize you're pregnant, it is important to start attending antenatals, because during antenatals they teach you how to carry on your pregnancy. They also do blood tests to check how prepared your body is to carry on the pregnancy. They also give you medications to help you and your unborn baby to carry on properly. They also do other lab tests like infections, malaria, to make sure you and your unborn baby are in good health. There are also other medications that are given during antenatals, like iron medications that can help you during giving birth. So it is very important to attend antenatals when you're pregnant. Don't step back at home, because by the time you go to hospital, you might be having an issue that will need to be attended to by the doctors. Some people choose to stay home till childbirth, which is very risky during pregnancy. It is important to start attending antenatal. Number 2, choose your hospital or your medical service provider well. Choose a hospital which has a low rate of a cesarean section. There are some hospitals that have very high rates of cesarean section that they don't have the time to monitor you for a vaginal delivery. So it is important you talk to your elderly, people who have been there, people who have gone through normal deliveries. Ask them to direct you where they did it from and their experiences, what they went through. That will direct you on the best place, and it will help you to choose the best doctor to monitor your pregnancy and to also help you get a normal delivery or a vaginal birth. Number 3, eat a well-balanced diet. When you eat a well-balanced diet during pregnancies, it helps your body, and also for the growth of the unborn baby. It helps the baby to grow up normally. It also gives you energy, it energizes, it keeps your body healthy throughout the pregnancy. So it is very important for you to eat a well-balanced diet. You have to eat all the classes of foods like carbohydrates, vitamins, fats, and drinking water also to keep you and unborn baby healthy. Number 4, do moderate exercise. There are exercises that can help you during your pregnancy and also can help you during your childbirth. There are moderate exercises that you can do, like walking. You can walk, you can do swimming. There are yoga exercises that are always taught during antenatal. So you have to do these exercises and avoid the heavy exercises like lifting of weight. These are not advisable during your pregnancy. It will help you to give birth normally when you do these exercises, because during exercise your blood vessels are opened up and the blood flow to the fetus. It will help to avoid complications like fetal distress, like we discussed in the previous topic. fetal distress can lead to cesarean section, but you want to avoid cesarean section, so you have to do exercise to make sure your baby does not end up in fetal distress. Point number 5, maintain a healthy body weight. During your pregnancy, try not to gain a lot of weight, because when you gain too much weight, even the baby will also gain too much weight, and the baby will be too big and it will affect the vaginal birth. Therefore, you might end up in a cesarean section. So avoid gaining too much weight during pregnancy. That takes us back to the point of attending antenatal. So as you're gaining weight, your doctors will be able to tell you whether the weight you're gaining is the normal weight for your pregnancy. Point number 7, avoid stress and have enough sleep. Stress is also a major factor that makes other mothers, pregnant mothers, to end up in cesarean section. When you're overstressed, even the baby becomes overstressed. So avoid stress by talking to your loved ones. If you have any fears of normal deliveries, talk to the doctors during antenatal, talk to the elderly people around you. They'll be able to counsel you and you'll go through your normal deliveries well. Try to have enough sleep during the ending of your pregnancy. When your pregnancy is at term, try to have enough sleep. Like when your pregnancy is older, 38 weeks, 39 or 40 weeks, try to have enough sleep of about 8 hours. It will restart your body and it will give you enough energy to push during your childbirth. Point number 8, avoid being induced. Induction or being induced is use of medication to start labor pains before you get the normal labor pains. Most times when you get induced, the rate of contraction is too high, and sometimes the cervix or the outlet into the vagina does not open hand in hand with the uterus. So contractions might be too much and the uterus might fail to open, and it will predispose you or expose you to cesarean section because the cervix has not opened in time. So try to avoid induction. Being induced can only help you maybe when you wait for labor pains up to about 40 weeks or beyond 40 weeks and there is no labor pains. That is when you can opt for induction. But before that, please try to hold on for the normal contractions to come so that the normal deliveries remains a normal delivery without induction. Point number 9, have external support during labor. When you're going to labor, there are these elderly people who have been there, people who have gone through normal deliveries. It is advisable you get those people and let them be your support during labor. They'll be able to support you and give you advice during your labor, so you will not fear, you will not have that fear opting for cesarean section. You don't have that fear of going through normal birth. That was all I had for you guys today. Thank you for watching this video till the end. Make sure you subscribe, please. Don't forget to subscribe to this YouTube channel. Also, turn on your notification bell so that you don't miss out any video that is coming every week from this channel. Thank you for watching. See you in my next video. Bye.